And we're the first behavioral health prevention and promotion dedicated hub. So we're leveraging a great model to bring an innovative prevention resource to Ohioans. Right, next slide, Nancy. All right. So the ECHO Hub is facilitated by the Ohio Center of Excellence for Behavioral Health Prevention and Promotion. And you can visit our website to learn more about the center's work. The website's listed on this slide. The center is funded by the Ohio Department of Mental Health and Addiction Services and administered by Ohio University's Voinovich School of Leadership and Public Service in partnership with the Pacific Institute of Research and Evaluation, as we call PIRE. Next slide. So if you are new to the Project ECHO model, I think it's probably most important to understand that the core philosophy is all teach, all learn. In each session, we'll start with a subject matter expert providing a didactic on the identified topic. But what makes ECHO so special and effective is the core value that everyone in the room has knowledge and experience to make a valuable contribution. And we can all learn from the work of our community members. Collectively, we have the wisdom in the room. Next slide. So why the ECHO model? Some benefits are listed here. We won't spend too much time talking about it, but I did want to highlight that this model democratizes information and expertise for the public good. It builds workforce capacity and ultimately improves outcomes for our communities. Next slide. So some helpful tips for today, just some general housekeeping. Please mute your microphones when you're not speaking. I know it's lunchtime, but please turn on your camera if possible. These sessions are really meant to build connections and relationships with our colleagues, and it's helpful to see each other's faces. I encourage you to use the chat feature throughout the session, particularly if you want to share resources or insights that are relevant to the discussion. And we have a wonderful turnout, so I think that the raise hand function may be the smoothest option as we move into the discussion portion of the session. Please turn off your AI note takers, and if you're experiencing technology issues, reach out to my wonderful colleague, Nancy Clough. Her email address is on the right-hand side of this slide. So as the Hub team, we are committed to creating an inclusive environment and providing all necessary accommodations. We'll start and end sessions on time and work hard to make good use of your time by providing quality content. The only recorded part of our sessions will be the didactic presentations, and this is out of respect for your privacy and the privacy of community members that you serve. Finally, we'll provide continuing education credits, which you can earn by completing an evaluation after each session. So we also have commitments that we ask from our participants. We ask that you create a safe and respectful learning environment by valuing the opinions of your colleagues, use inclusive language, and protect the privacy of everyone involved by keeping discussions confidential. We encourage you to be open in sharing your experiences, knowing that this is a supportive space. So finally, I'd like to remind you about our upcoming schedule. This Youth Vaping Prevention ECHO will meet every second Wednesday of the month, and we are launching an adult low-risk drinking ECHO series on the fourth Wednesday of every month. So that will be on the 25th, and we invite you and encourage you to attend that session as well. So with that, I would like to introduce our presenter, Dr. Ashley Merianos. Dr. Merianos is a professor in the School of Human Services at the University of Cincinnati and a research affiliate member of Cincinnati Children's Hospital Medical Center and the Third Hand Smoke Research Consortium. As a health services researcher, Dr. Merianos has extensive training and experience in the epidemiology and prevention of substance use, with an emphasis on tobacco, quantitative statistical methods, and clinical and translational research in the pediatric healthcare setting. She is a certified health education specialist and a tobacco treatment specialist. So welcome, Dr. Merianos.
Thank you, Sarah. So the title of the presentation is Behind the Hype, Data-Driven Insights into the Vaping Epidemic. Before I begin, I just want to go over presenter disclosures, and I have no relationships to disclose. So for the learning objectives for today, we will examine the landscape of youth vaping, including current data sets and environmental factors that impact the perception of harm associated with vaping. And we will also describe the immediate and long-term health impacts of nicotine addiction. I might be sharing, am I sharing the wrong screen?
You're good, Ashley. I can see it.
Okay, sorry. Let me reshare just one more. Okay.
Yeah, we can see your learning objectives now.
Okay, great. Sorry. So it's the big screen. Okay,
Yep.
great. Thank you, Nancy. Okay, so starting with an overview of the US landscape of youth vaping. Can you still see my big screen?
Yep, you're great.
Okay, sorry. It keeps like highlighting my other screen, so I wanted to make sure. The FDA and CDC analyzed nationally representative data from the 2024 National Youth Tobacco Survey, and I will refer to it as NYTS. So this is a cross-sectional school-based survey that included about 30,000 US students who were enrolled in either middle school, so grades 6 through 8, and high school, so grades 9 through 12. While this slide also shows nicotine pouches, which is a hot topic right now among youth, I will focus on e-cigarettes in this presentation. So in 2024, e-cigarettes remain the most commonly used tobacco product among US middle school and high school students, which has been a trend shown since 2014. So as shown on this slide, about 6%, which equates to about 1.6 million students currently used e-cigarettes, which was defined as using e-cigarettes within the past 30 days. So this included about 3.5% of middle school students and about 8% of high school students when looking at the grade level patterns. I want to mention, however, that encouragingly from the 2023 NYTS to the 2024 NYTS, overall current e-cigarette use among middle school and high school students did significantly decline from about 8% to the 5.9%. So this slide also shows findings from the 2024 NYTS, which actually was just published within the past week, so perfect timing for this inaugural session. Of youth who self-reported using e-cigarettes in the past 30 days, the majority reported frequency of use patterns of 1 to 5 days overall, so about 44%, followed by 20 to 29 days overall at about 38%. And I want to mention that overall combines both high school and middle school on this slide. Alarmingly, over 1/4 of current e-cigarette users reported daily use, so all 30 days, which included about 30% high school students and about 16% middle school students. I want to mention that the next two slides actually show findings from the 2023 NYTS, since sociodemographic patterns were not yet published for 2024. So interestingly, females reported higher current e-cigarette use, so using within the past 30 days, at about 9%, compared to about 6% for their male counterparts. And as you could see, there were similar trends found by grade level. So about 12% for females enrolled in high school compared to 8% of males enrolled in high school, and about 6% of females enrolled in high school, and about 3.5% of males enrolled in middle school. This slide also shows 2023 findings. So current use of e-cigarettes did vary by race and ethnicity overall. As you could see, the highest was among non-Hispanic multiracial students at about 10%. And about 9% of Hispanic students reported current e-cigarette use. About 8% of non-Hispanic white students reported current e-cigarette use. About 6% of non-Hispanic American Indian or Alaska Native students reported e-cigarette use. And then last but not least, 6% of non-Hispanic, Black, or African American students reported current e-cigarette use. And these trends were pretty similar when it was looking at high school breakdown, but interestingly, middle school students, the highest was among those of Hispanic origin, followed by non-Hispanic Black and non-Hispanic White. And I want to mention that there were no data available for non-Hispanic multiracial and the American Indian and Alaska Native student group. That's why there's the marks through that. So moving on to Ohio, in 2021, 20% of high school students in Ohio used e-cigarettes on at least one day in the past 30 days. I want to mention that during this time, the e-cigarette prevalence among high school students nationwide was about 18%. So this was a little bit higher. And also these data derive from the 2021 CDC Youth Risk Behavior Survey, which is the most recent statewide data available. So the NYTS didn't provide state level data. So what are the factors that influence the perception of harm associated with vaping and therefore influences adolescents' use patterns? So there are four key factors that I will quickly cover. So that includes advertising, e-cigarette flavors, social influences, as well as acquisition patterns, so where are they getting them, and nicotine, which is included in most e-cigarettes. Do these brands look familiar? Some of the brands behind these e-cigarette products are actually the same companies that produce traditional cigarettes. For example, the company that sells Kool sells Blue, the company that sells Marlboro sells Mark 10, and the company that sells Camel sells Views. And so tobacco giant Altria, maker of Marlboro, paid $13 billion to get in on Juul. So why does this matter? The tobacco industry spends about $1 million per hour on tobacco advertising and promotion, which can easily reach youth and influence their use patterns. So starting with what leads to e-cigarette use, focusing specifically on advertising, youth can see advertisements for tobacco products while engaging in common activities such as going to a convenience store, gas station, using the internet, watching TV, or going to the movies, as well as reading online newspapers and magazines. So in the 2021 National Youth Tobacco Survey, among youth who reported engaging in those common activities, about 70% report exposure to marketing or advertising for e-cigarettes. So specifically listed on the slide, about 59% saw advertisements in retail stores, followed by about 36% on the internet, and 29% in newspapers or magazines, and finally about 22% on television, streaming services, and movies. I want to mention that there are policies in place to stop the tobacco industry from some marketing tactics, but unfortunately there are some loopholes. So what leads to e-cigarette use? Another key factor is flavors. So in 2023, and in the new results from the 2024 National Youth Tobacco Survey, nearly 9 in 10 middle school and high school students who currently used e-cigarettes used a flavored product. And the most commonly used flavors reported by these students over the past 2 years were not surprisingly fruit, or a candy, dessert, other sweet flavor, and also a mint and menthol flavor. So what leads to e-cigarette use? The next key factor is social influences. So unfortunately, perceived harm among youth has been historically influenced by their peers and friends. So studies, including some of my own published collaborative work, have shown that perceived substance use among friends influences actual substance use. So therefore, and not surprisingly, the 2023 National Youth Tobacco Survey reported that over 3 in 10 adolescents got e-cigarettes from a friend or bought the products themselves. 29% had someone else buy the products, and 22% had someone offer the products to them. And last but not least, and probably the most important factor for health reasons, is nicotine. Here you will see the dictionary definition, which is a drug found in tobacco plants that can have stimulating effects. So briefly, some immediate effects of nicotine include an increased heart rate, altered brain chemistry, increased stress, and it affects all parts of the body when it is inhaled. So there are actually different types of nicotine, and the pH scale on this slide measures how acidic a solution is. So an acidic solution has a high concentration of hydrogen ions, greater than that of pure water. So examples of acidic items include lemons, soda, batteries. A basic solution that has a low hydrogen ion concentration is less than that of pure water. So examples of basic or alkaline solutions, so on the right side, include baking soda, toothpaste, or eggs. So therefore, pH matters when it comes to how harsh the feeling of nicotine is on one's body, particularly when one's throat when nicotine is being inhaled. So most nicotine in cigarettes and some e-cigarettes is what we call free-base nicotine, which means it's an alkaline on the pH scale. Since free-base nicotine is an alkaline, it has a harsher feeling on the throat. Conversely, nicotine salts are considered an acid and are less harsh feeling on your throat. And I want to mention that this is a particular concern for young people because it allows for nicotine to be used more easily, which increases the likelihood of trying an e-cigarette and getting hooked. So for example, that's probably why Juul was such a phenomenon. Another type of nicotine is synthetic nicotine, which is made in a lab instead of being derived from the tobacco plant. So examples of e-cigarettes that are made with this type of nicotine include Puff Bar and Elf Bar, which is currently one of the top e-cigarette products used by US youth, according to the National Youth Tobacco Survey. So e-cigarettes allow the user to exhale clouds that are not harmless water vapor. Not surprisingly, the tobacco industry does prefer the term vapor because it implies that it's harmless. E-cigarettes can create an aerosol that can be harmful to health. So an aerosol is a suspension of fine solid or liquid particles in gas. So examples include cleaning products and cooking sprays. And it's difficult for consumers to actually know what is in an e-cigarette product. For example, some e-cigarettes have been marketed as containing zero nicotine, and they actually have been found to contain nicotine. Besides nicotine, e-cigarette aerosol can also contain cancer-causing chemicals such as tobacco-specific nitrosamines, heavy metals such as lead, and ultrafine particles that could be inhaled deeply into the lungs and harm the body. Additionally, flavoring has been linked to a serious lung disease, if you've heard the term popcorn lung. And even though e-cigarette aerosol generally contains fewer harmful chemicals than regular cigarettes, it does not mean that they are safer. So this applies to both people not only using e-cigarettes primarily, but also bystanders who may be exposed to the secondhand aerosol from other people using e-cigarettes. So unfortunately, nicotine can impact the developing brain. So important growth is happening in adolescents' brain and will continue happening until they are about 25 years of age. So the brain is the last organ in the human body to develop fully, and consequently, it is the prefrontal cortex, and this is the part of the brain that is responsible for making decisions. Which develops around the age 25. So exposing the brain to nicotine when it's in this important developmental phase can cause addiction and also harm the brain. And each time a new memory is created or a new skill is learned, stronger connections or synapses are built between the brain cells. And nicotine can actually change the way that these connections are formed, which can harm the part of the brain that controls attention and learning. So for youth, any exposure to nicotine is unsafe. And putting nicotine in their body can be dangerously addictive, and it can also prime the brain for addiction to other tobacco products or other drugs such as cocaine. So what are the short-term health consequences of e-cigarette use? Unfortunately, we do not know the long-term health consequence of e-cigarettes due to being on the market for a relatively short time. They've been sold in the US for nearly 20 years. So here's a list of the short-term health consequences. And please know that some of these findings are derived from animal or lab studies in addition to human studies. So not surprisingly, nicotine addiction, and then there's mouth and throat irritation, dry cough, increased respiratory infections, asthma symptoms, also changes in neuroanatomy, increased heart rate, decreased oxygen saturation, increased airway resistance, just to list a few. So as mentioned earlier, and unfortunately, the use of nicotine can rewire a youth's brain to become more easily addicted to other drugs. Nicotine is quickly absorbed into the body and goes directly to the brain. So nicotine activates areas of the brain that makes a person feel satisfied and happy. It is important to note that nicotine addiction can also look different from adolescent to adolescent, and some signs of nicotine addiction among youth can include cravings or feeling the need to go use tobacco, going out of their way to use e-cigarettes, feeling anxious or irritable if they want to use tobacco but can't because they are in school, for example, or simply finding it hard to stop. And on this slide, I have the FDA's longest running campaign called The Real Cost, which actually educates teens on the health consequence of smoking cigarettes originally. And in recent years, they have prioritized e-cigarette prevention messaging to keep the trends going down in terms of e-cigarette use. So I've included the video. Let me see how I'm doing on time. Okay, I'm just going to quickly show, and then if you want to watch more later, then please feel free to go back to my slides that were uploaded.
Microwavable mac and cheese. I woke up craving it.
It's all that's on my mind.
I couldn't control my own decisions anymore.
I was screaming, yelling.
I was not myself at all.
Vaping was just constantly veering me towards destruction.
So that video is only 3 minutes, and it will go through different stories from different teens. Nancy, am I still okay with showing my screen? Okay, thank you. Okay, also, I want to mention for those who are working with youth, there are 2 great free quitting resources. So the first is Quit Vaping, Smoke-Free Teen, which I'll quickly show. And I want to mention that it's at smokefree.gov, but there are different tabs. So for example, for vets, women, teens, Spanish, and those above 60 plus. And so this website shows how to build a quit plan, and also just like different ways to engage with teens. They can also sign up for text, for example. And then also the Truth Initiative digital quitting program. And that's also a free program available. Okay, and finally, I just want to say a big thank you to the Ohio Center for Excellence for having me at this inaugural session. And also thank you all for attending this presentation. I think the biggest key takeaway in behavioral health and in public health and whatever field you may be in is that we still have a lot of work to do when it comes to youth e-cigarette use. Thank you.